Trying to conceive or thinking about your future fertility? I'm Dr. Sharon Moayeri, owner and founder of OC Fertility. Fertility starts to decline as early as 30 and more significantly after 35. So 35 is not a magic number that you should wait for. And in fact, if you're planning to delay having children until your 30s, you definitely want to have your fertility evaluated and consider freezing eggs or embryos if you plan to wait to have kids until your 30s. Ovulation doesn't happen on the same day for everyone. In fact, ovulation happens at a variable time depending on your cycle length, and typically it's going to be 2 weeks before your menstrual cycle starts. So if you have a 28-day cycle, it'll be roughly around day 12 to 14, but if you have a longer cycle, say a 40-day cycle, it's going to occur somewhere around day 35. And in fact, there could be a 1 to 3 day window around that, and that's normal for people who are normally ovulating. You can get pregnant even if your periods are irregular. You do, however, want to talk to your doctor about this. It might be hard to track when you're ovulating, and it could be that you're not ovulating. So it's important to see someone if you haven't conceived within 6 to 12 months. Sometimes this can indicate an endocrine disorder called polycystic ovary syndrome, but it can also mean that there's something else going on. It could be a thyroid dysfunction. There could be hormone imbalances related to prolactin hormone. Sometimes this is just how your cycles are. Definitely talk to your gynecologist if you're having irregular periods. Male factor infertility accounts for nearly 50% of infertility cases. A lot of people underestimate how much male factor contributes to a couple's infertility, and we're seeing that it's becoming more of a problem over time, especially as we see environmental influences, dietary changes, and aging in the population. And certainly age affects male factor infertility as well. A lot of people come to me and have a healthy lifestyle, especially where we live in Southern California. And certainly that's an important factor for improving your fertility, but it's not the whole story. You want to maintain a healthy lifestyle because you have control over that. But a healthy lifestyle doesn't overcome aging of the ovaries. And so age still matters, and there's some things that are going to be out of your control no matter how healthy of a lifestyle you may have. Knowledge is power, and if you're trying to conceive, you want to have the right information so that you can make informed decisions. If you're trying to conceive, make sure that you're well informed and that you're getting the answers that you're looking for.